Hello and welcome. The number of COVID-19 positive cases continue to rise, particularly in cities like Mumbai and Delhi. But one of the problems and outcomes of these rising number of cases is the load on hospitals, which is increasing, and the hospital's inability or seeming inability to admit all the patients for both COVID as well as non-COVID cases. So let's try and understand from one hospital, what is the load level, how are they coping with it, and how are they responding to the rising case levels? To discuss this, I'm joined by Dr. Vernon Desa, Medical Director at Saifee Hospitals in Mumbai. Right. So first question, I know you are a 254-bedded hospital. Could you tell us what is the split amongst these beds in normal times and at what load are you working at right now?
Well, we have bifurcated our beds in a specific manner based on guidelines given to us by the Municipal Corporation of Greater Mumbai, and where we have specified a certain beds for COVID patients and the balance beds for non-COVID patients. For COVID patients, based on what we could provide, we have provided about 100 beds for COVID, wherein 74 beds are for stable patients and the balance 26 beds are for critical patients who come with COVID positive reports. The difference is that from 254, we have not opened out or commissioned all the balance beds. We have kept a certain amount of beds for non-COVID patients. So currently we have about roughly about 60 to 70 beds for non-COVID patients. So the majority of our work is COVID work. The balance work is non-COVID work, which is lesser than the COVID work.
Right. So you're saying out of 254, you are currently operating at about 160 to 170 beds. Is that correct?
Roughly 200 beds. Roughly 200 beds. But out of the 200, 100 are COVID and the balance are non-COVID. But out of the balance, we have about 60 to 70 beds occupied. So we still have spare capacity in the non-COVID side, which we have kept depending on exigencies, etc.
Right. So when you say you have spare capacity, does that mean that you have enough doctors, nurses, and support staff to manage those beds?
Yes. As a matter of fact, we have not been hit very badly by this COVID crisis because we made sure that the staff, the nursing staff and resident doctors were available for managing the patients for the whole hospital. We have provided them residential quarters. So, and we have had hardly any attrition by way of nurses leaving and going to other hospitals or going back to their native place. So we have not suffered due to lack of staff or less staff or anything like that. The only issue is that we had to do a surgical operation on the entire hospital because on the building of the hospital, because we have separate access points for COVID patients. We have separate lifts provided, separate floors which are solely dedicated to COVID. That is all at the northern end of the building. And at the southern end of the building, we have provided various floors for non-COVID patients with separate access points, separate lifts. So we have made it very clear to all our patients and our doctors and visitors that there is no risk whatsoever if you enter the hospital. You enter from one gate if you are a normal patient who's coming in for some other treatment. And if you come for COVID treatment, it's a separate entrance. If you come by ambulance or you walk in or whatever. And we have a fever clinic established on the ground floor next to the EMS, next to the emergency medical service. And we also have a full-fledged staff in the EMS, round-the-clock postgraduate doctors who attend to patients at all times of the day or night. So, by and large, this formula has worked for us.
Right. So you mentioned 76 and 24. Now, what's the occupation rate there? I mean, are your critical care beds all occupied or only some of them?
All occupied. As a matter of fact, we are seeing a different picture now since the past week or so, wherein
Mm-hmm.
our stable patients have been going down, but the critical
Mm-hmm.
patients have been increasing.
Mm-hmm.
So maybe now with this, the curve sort of flattening a little bit, it appears to be, at least for us, I don't know about the other hospitals, we have lesser stable patients and more critical patients. And we upload our data on the MCGM site and all that on a daily basis.
Right. So when you about the critical patients, can you walk us through some more? Can you give us some more insights on what the level of critical status are they? Are they going into intensive care or ventilator and so on?
Yes. See, as a matter of fact, the patients that have sometimes come in, but they have comorbid symptoms, and they land
Mm-hmm.
up, like say, with diabetes, hypertension, pre-existing heart disease, etc. They sometimes deteriorate, and we have to move them from the stable side to the critical side. Uh, uh, Patients sometimes who we presume that they will get well and go home fast, they develop severe breathing problems, and we have to put them on BiPAP ventilation. Many times they recover with that BiPAP, or if they don't recover, uh, they go on to the ventilator. We've had patients who we thought were young, presumably fit, and suddenly developing some complication, severe breathing difficulty, even on 15 liters per minute high flow oxygen, they have not recovered. And some or the other, they get into a spiral, develop multi-organ failure, kidney failure, and things like that, and their lungs get completely opaque due to this ground glass appearance on the CT scan, and uh, they crash. So it's like a paradoxical situation where we see young people. We thought that young people would be sort of
Right.
more resistant to this infection, but young people have developed it, come and passed away, whereas older people whom we thought with comorbid features, they have managed to pull through and recover and go home. So this is the type of paradoxical situation we have seen. We are learning as the days go by, because nobody can claim to be an expert in this. COVID is a new entity. Sorry.
Right.
Yeah.
So if I come back to those 76 patients, in what condition or state are they coming to your hospital? Do they already, obviously they are positive, but are they showing symptoms? If so, advanced symptoms? Are people coming too late to the hospital? Is that another issue?
I would not say people are coming late, but the BMC has changed the guidelines now. Asymptomatic patients, they say you should not get tested. When they have symptoms, they come to the hospital. So we set up a fever clinic to start with in in the first week of April, where all the patients come in through one gate of the hospital. We examine them. If we have a doubt, we get their testing done right on the spot. So the percentage of these patients, the flow is there. But as I told you earlier, the flow is lessening as far as stable patients go. We are getting more of critical patients either coming in critical or coming in stable and becoming critical after hospitalization. So this is what we have observed.
And what is that telling you? I mean, even at an early stage right now, as a if you were to try and draw some conclusions.
At an early stage like this, I mean, see, we have to live with this problem.
Sure.
And uh, people, it is spread through the community. And we ourselves, we spend about 8 hours a day in the hospital. We move around the hospital. So we ourselves are at risk. And my view is that after a period of time, this virus will mutate. And what we are seeing now is a different type of virus than what was there in Wuhan and what was there in Europe and what was currently in USA. So this virus, which is now specific to Mumbai, is moved in such a way through certain communities, and its potency has gone down to a considerable extent. This is my personal view, and this is the view of some experts, even in the States and in UK, that after some time, this virus loses its potency. And you
You feel
see
that do you feel that you're already seeing that loss of potency
I feel
in
so.
Mumbai?
I feel so. In the past 2 months, in the month of April and May, we had so many calls and so many emergency cases. Now, for the past week or so, we are hardly seeing that type of, firefighting like we had in 2 months. It's sort of slowing down. And looking at the literature, discussing with experts. My own daughter is an expert in the States. She runs 2 ICUs in San Francisco, and I discuss with her regularly, and she tells me that we are seeing a complete change. Now she hardly has. It's come down from say 50 patients to hardly 4 patients in her own hospitals. So the the curve is flattening, or the curve is even going down, and
Right.
maybe towards the end of June, we'll see a remarkable change in the scenario in Mumbai.
Right. Yeah. And let's hope for that. So, and let me ask you about the non-COVID patients now. I mean, what is the kind of inflow that you've been seeing there? And I know that people are not coming to you. Elective surgeries are ruled out at this point, but there must be other cases. And are you seeing what is the kind of load you're seeing there? And broadly, how does the load in your hospital at this point compare with, let's say, the same month last year?
Well, year on year, we do see there is a dip in our occupancy. That is indisputable. I mean, we have to face it, because in the
Sure.
first place, patients are scared to come. So we only get emergency cases like patients who come with a myocardial infarction, or patients who are primies and who are in labor, and we have to take them in, who are registered with us. We had some primies who were in labor who were not registered, and yet we took them in on humanitarian grounds, and later on we tested them and found them to be positive. So all these permutation combinations are there. But by and large, our heart department works, our cath lab is functioning, our non-interventional cardiac department is functioning, uh, all other diagnostic services are functioning, and we are getting only emergency cases like patients who crash, fractures, uh, trauma cases, etc. And we have on an average about 50 to 55 such patients, 60 patients around per day, non-COVID patients who come in to know whether this patient is really positive or negative. In an emergency, we don't discriminate, we take them.
Right. One more question, Dr. Desa. So, we keep reading reports now almost every day of patients turning up at hospitals, being turned away, moving around in ambulances, desperately searching for a hospital to get admission to. So, why is that happening in your mind? Because you, for example, are saying that you have actually very little load and you are accepting almost every patient who comes to you. Is it also because of where you are
No,
located,
we have,
much deeper in
sorry,
South Mumbai?
sorry for interrupting you, but we have a heavy load in the COVID side. The
Right.
non-COVID, yeah. So what you are asking about is the COVID type of patient. We don't refuse any COVID patient or suspected COVID patient. As I told you, we have our triage OPD. Over and above that, I have set up a, a, a general triage OPD at a separate entrance of the hospital, wherein all patients who walk in are triaged, checked, and in case they've come for an emergency investigation, or to see some doctor, or to undergo some procedure, we send them through a different access into the hospital. They do their
Right.
procedure, they see the doctor, and then they leave. But that has really proved to be a boon to us, because we have managed to segregate patients and ensure that a potential case will not be missed out.
Let me sort of rephrase that earlier question as well. So, Dr. Desa, the thing is, we are reading reports of patients who are not getting admission into hospitals, regardless of what condition or what disease or illness they're facing. Now, is that something that you are also encountering? And if you're not encountering, is it because also where you're located in deeper South Mumbai? I'm just trying to understand, because at one level we are seeing all these horror stories, not just in Mumbai, in cities like Delhi as well, that hospitals are turning away patients and refusing to admit them because they don't have COVID positive certificates, even if they're non-COVID patients, and therefore they are, forced to move from hospital to hospital. In many cases, they've passed away.
Well, we have not encountered that type of experience, because,
Sure.
as I told you, we have set up a triage and we have set up a fever clinic. So we segregate, and we make sure that patients are adequately uh, triaged. And if we have a doubt, we do the test right on the spot. So, to my knowledge and through the experience of the past 2 months, we have not refused any patient. We have even had patients who have come desperately by car, who have collapsed in the car, and we have taken them in and assisted them and admitted them to our ICU without knowing whether they were COVID positive or negative. And later on, we do the test. Just 4 days ago, I admitted a patient in
Yeah.
the ICU with a similar problem. She was so breathless. She had an oxygen saturation of 60. I thought she would collapse and die. So we took her in, we kept her in the ICU. Now she's stabilized. And now she's negative too. So with that type of breathlessness and collapse, you always think first thing is the patient is COVID. But still, on humanitarian grounds, we don't turn anybody away. We have never told
Right.
any
And you're
patient
not.
to go away from the ambulance, from the gate of the hospital. Never.
And you're not saying, for instance, as some other hospitals are alleged to be doing, asking for money upfront in several lakhs. Only
Don't
then would
know.
you then admit them.
These are the horror stories we get from Delhi and other places, where reporters go on ringing up and asking, "Do you have a bed and how much does it cost?" We tell them upfront, whatever the BMC has laid down, 80% of your beds are price controlled, regulated beds. The other 20% are unregulated beds. We follow that mandate strictly. So there's no question of telling them some exorbitant rate uh, and getting away with it. We don't mind losing money, but our first focus is to save lives. That's what we doctors are in the profession of saving patients and treating them and saving lives.
Right. Last question, Dr. Desa. When do you see capacity returning to higher levels, or let's say pre-COVID levels? I mean, do you see all your staff, nursing staff, doctors, everyone coming back? I mean, there was a lot of fear earlier. Maybe it's less now. What's your own sense?
My own sense is maybe back to normal sometime in the first week of August. Should be. Right now, we are sitting on the cusp, and we don't know which way things will turn. If there's more community spread and more clusters form and more containment zones, then we will go on and on and on, and it won't end. But if we have to let the curve flatten and go down in Mumbai, uh, all the norms have to be followed, which are repeatedly told to us on television and all over. Unfortunately, I don't know. People tend to go a little off board, and that is what may cause a problem in the next 2 months. But around the first week of August, if people are disciplined and things happen in the right way, maybe we'll get most of our non-COVID and our regular work back, and maybe we'll start doing normal work even.
Right, Dr. Desa, thank you very much for speaking with us, and I do wish you and your colleagues all the very best for the
Thank you
coming
very
months.
much. Thank you very much, and thank you for inviting me too.